An HSA qualified health plan is a high deductible health plan attached to a health savings account, which also meets IRS requirements for benefit design and eligibility requirements. The health savings account is a deposit account that is attached to a health benefit plan. Then the contributions to this account can be used to supplement your benefit expenses or pay for your benefit expenses that you incur with your health plan. Medical care under an HSA qualified plan is the same as any other plan. The fact that you have the financial instrument doesn't impact whether you can visit a provider or choose a pharmacist or any other ways that you interact with your doctor today. Funds can carry over from the year in which they're contributed. There are no use it or lose it provisions in this account. Your contributions and investment credits accumulate over time as long as you have the account.
When you go see your doctor, an HSA qualified plan behaves very much like any other form of healthcare coverage. You go see the doctor, you get the coverage, the services that you need, and you get a bill. And then depending on how the claim is processed, you're responsible for your share of that expense. With an HSA account, you have the flexibility to use those dollars if you need to pay that out-of-pocket expense. The big difference that you'd notice with an HSA qualified plan is at the pharmacy. And again, because you're responsible for deductible up front, when you go to fill a prescription at the pharmacist may ask for payment at that time. And again, you have the option of taking those dollars out of pocket or using your HSA account at that time to pay for the prescription.
You know, I think the perfect person who would do well with an HSA qualified plan is probably a person who's relatively savvy about their health care, who is interested in being engaged in their health care decisions, and who wants more control over their health care dollars. I think HSA plans can be good for almost anyone, as long as you understand what your financial exposure is and you're able to plan for that. You know, I think that what attracted me to the HSA, it was what attracts most people to the HSA. A combination of three things. The ability to put away money tax-free for future medical expenses. The ability to grow that money tax-deferred year after year. And then most importantly, I think, is the ability to save pre-tax money for medical expenses in the future, especially in retirement. None of us knows what the future is going to bring and what's going to happen to us. But definitely saving money in an HSA right now allows you peace of mind in terms of knowing that you've done the best you can right now to ensure that you're all set for the future.